Hi, I am Dr. K.R. Meghanadh. I done my MSc ENT from the prestigious the Postgraduate Institute of Medical Education and Research, Chandigarh. I am having 29 years of experience in ENT, and I started my practice and career in Hyderabad in 1994. One of the commonest ENT problem in the society is in fact common cold. This is caused by an influenza virus. It usually affects during the change of seasons. Whenever there is a change in the temperature and humidity, the virus genetic structure gets modified on its own, and this becomes a new variant of the same virus, and it starts infecting the people. This is a very common thing what happens, and that is why it is called common cold. Almost every individual will get at least one attack of this kind of cold in a year. But if somebody gets more attacks, more than 2 or 3 times in a year, and definitely that is abnormal. There is something else problem other than the common cold. In other words, if somebody gets more than 2-3 attacks of cold in a year, one has to get investigated and why he is getting, and it has to be treated appropriately. Now, coming to the common cold usually will have complaints of nasal discharge, some secretions, sometimes watery, sometimes it is thick fluid coming from the nose, with a lot of congestion in the nose block, headache, fever, and other body aches and other similar complaints. And these things usually last for 5 days. If they last more than 5 days, it is probably a complication or a further extension of the common cold into sinusitis. Many patients keep asking me, many friends also keep asking me, what is the treatment for this common cold? Do we have to treat the common cold, or without treatment the common cold will subside in 5 days? This is the usual questions put by many of my friends. Here the answer is very simple. Common cold, which is a viral infection, will subside in 5 days in most of the cases, say 99%. But in 1% it can lead to a sinusitis, it can lead to a complication. A complication can happen either in the ear in the form of ear pain and ear infection, or it can happen in the voice box in the form of hoarseness of voice or a change in voice, or it can happen in the lungs in the form of a cough or a bronchitis. All these complications can be prevented by treating the common cold. Now, how to treat it? It is very simple. Take oxymetazoline or xylometazoline nose drops 2 times a day, and these are available as a OTC product, over the counter product in all the medical shops. Otrynose, Otrivin, similar nose drops. You can put these nose drops 2 times a day only for 5 days or at the most 7 days. It should not be continued beyond that. And after putting these drops, take steam inhalations. In the steam inhalation, just take a hot water in a bowl, in a tumbler, keep it in front of you and allow the steam to go into your nose. That is all. Do not put any medicine into the hot water. You need not cover yourself with a blanket and have the more of heat than the steam. So, here you require only steam to the nose. You do not require heat to the face. So, this is a very important point, especially in children. Many times I have seen few of my friends giving the steam inhalation, covering the child with a blanket, making the child suffocate, making this a very bad experience to the child. That should not be done, and in fact that is not required. And if you do this simple precaution, most of the common colds subside without a complication, without progressing into the sinusitis. This is a small tip I would like to share with you, all the citizens of the country, to be away from the complications of the common cold and development of sinusitis. With a simple instruction, we can avoid getting into the acute or chronic sinusitis. Thank you.